Let's take a look at the definitions of three of the key words that are used in health and safety. Health. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease, injury, or infirmity. Safety. Safety refers to the absence of risk of serious personal injury or a state where the risk of harm has been eliminated or reduced to an acceptable level. Welfare. Employers are required to provide adequate arrangements for the welfare at work for their employees. Welfare facilities are those that are necessary for the well-being of employees, such as toilets, hand wash stations, rest and changing facilities, hygienic conditions to prepare and consume food, access to drinking water, and first aid provision. Besides these three main keywords, there are other keywords too, for which you can refer to the student course material and the LMS.
Now, let us see the worldwide accident statistics. You know, there is something known as ILO, that is International Labour Organization, and India, many countries are members of that. So, we all follow our rules and regulations based on the ILO guidelines. According to their survey, every year there will be a fatal safety incident of around 3,34,870 and a fatal health incidents of 9,92,445 problems occurring worldwide. So, this is an alarming figure. So, ILO has made their recommendations and conventions, and other countries have to follow that. Based on their geographical location, they make their own rules and regulations.
In general, there are three main drivers for managing health and safety: moral, social, and economic. Society exerts pressure through these three overlapping and interacting spheres of influence, and hence, these are the three main reasons why an organization has to manage health and safety. Let's take a closer look at this.
Moral, social, and economic reasons for health and safety. Moral expectations. Morals are the codes of conduct or rules of behavior imposed by a society regarding what is right and what is wrong. Social and legal expectations. The management of occupational health and safety risks can be influenced by a number of social factors, such as the economic climate, globalization of business, an increasingly migrant workforce, and in the developed world, the expectation that corporations will act in a socially responsible way. The legal responsibility for health and safety at work rests primarily on the employer. The employer has a duty to provide the following: safe place of work, safe plant and equipment, safe system of work, training, supervision, and competency of staff. Economic expectations. Accident and ill health cost money.
When an accident occurs, there will be direct and indirect costs associated with the event. Direct costs are measurable costs arising directly from an accident or incident. Direct costs usually include workers' compensation payments, medical expenses, cost for legal services, and so on. Indirect costs are costs arising as a consequence of an accident or incident. Examples of indirect costs include training replacement employees, accident investigation and implementation of corrective measures, lost productivity, repairs of damaged equipment and property, and costs associated with lower employee morale and absenteeism. It is often assumed that most accident and incident costs are recoverable through insurance. This is a dangerous misconception. Insurance policies do not cover everything. It has been estimated that uninsured losses are between 8 and 36 times greater than insured losses. Uninsured costs can include lost time, sick pay, damage or loss of product and raw materials, repairs to plant and equipment, extra wages, overtime working, and temporary labor, production delays, investigation time, fines, loss of contracts, legal cost. Accident and ill health cost can be likened to an iceberg. Costs that are recoverable are visible, but those that are unrecoverable are hidden below the waterline and are many times greater.